Good evening. This is a presentation of my DNP project proposal. The project is titled, How Can a Nurse-Led Transitional Care Program Impact Older Adults Across Healthcare Settings? This project emphasizes how a nurse-led transitional care quality improvement program can reduce rehospitalization and healthcare costs while increasing patient safety and satisfaction. Elderly individuals are often confronted with complex multiple comorbidities. When discharged from the hospital, they are likely to face challenges adhering to the treatment plan, especially medication and follow-up. Developing a transitional care strategy and plan can reduce readmissions and rehospitalization and enhance safety standards. The primary concern is that current discharge instructions need to focus more on the elderly patients who may lack caregiver support and may have multiple comorbidities, which are directly linked to increased risk of utilization of the healthcare system and readmissions. The essence of a gap analysis is to demonstrate that hospitals are below the expected HCAHPS national average and their contributions to health challenges among older adults. These are part of the justifications for improvement. Problem statement. Discharge instructions are sometimes fragmented, contributing to patient confusion. Increased readmissions are associated with high cost of care and a negative impact on HCAHPS scores. Gap analysis. Patients have limited knowledge of the best ways of engaging in care post-discharge, especially medication adherence. Healthcare organizations are scoring below 58% on HCAHPS, which is below the national average of 60%. The primary objective of the project is to oversee the creation of a nurse-led transitional care program. This is aligned with the PICOT question that mainly provides guidance on the most appropriate evidence-based mechanism that can ensure better interventions to minimize readmission rates. The overarching aim of the project is a successful implementation of a nurse-led discharge program focusing on patient education and preventing the risk of readmission. The PICOT question is, in elderly patients older than 65 years old discharged from the hospital, how can a nurse-led transitional care intervention program compared to the current discharge instruction affect readmission rate within 12 weeks? The project was mainly focused on older adults preparing for discharge. The setting is a 169-bed capacity hospital. From the SWOT analysis, it is evidence that while there is sufficient support from the interdisciplinary team, there are still gaps compromising the discharge process and presenting with diverse risks. However, there are also opportunities for improvement. The SWOT analysis. The strength, was the involvement of the interdisciplinary team in discharge planning and care partner discharge meeting. Weaknesses: the practice gap can affect reimbursement, can reduce the HCAP score, and compromise patient safety and satisfaction. Opportunities are increased patient satisfaction and improving the HCAP scores and reducing healthcare costs. Threats: doing nothing will only worsen the problem. Data collection and expected outcomes. Expected outcomes are improved knowledge and skills in adhering to discharge instructions, enhanced compliance with medication and follow-up, improved level of education and satisfaction among staff and patient. The data collection that is being used is interviews, surveys, and follow-up calls, and comparison of pre and post intervention outcomes. Appendices: annotated bibliography, synthesis table, keeper table, search strategy table, SWOT analysis, gap analysis, and fishbone diagram. The expected outcome include improved knowledge and understanding among patient on self-care initiatives, better compliance and quality staff education. Data collection will be through interviews and surveys to enable comparison of results before and after the implementation of the intervention. Thank you.